We're here at the Health Innovation Conference 2025 at the Venetian in Las Vegas, talking to all sorts of leaders about the future of healthcare and health technology. And joining me now are two of those leaders, Berzin, she's the CEO of Parsley Health, and Andrew Lacy, he's the founder and CEO of Prenuvo. Welcome. It's great to be joined by both of you here at this event, and I know your companies are partnering together. What more can you share about that partnership?
Well, we're really excited to be partnering. You know, at Parsley Health, where we practice functional medicine nationally, we were already seeing lots of patients excited about full body MRI, already using Prenuvo, and we were already giving clinical guidance around how do you use that information to optimize your health, to treat disease. And so by partnering, we're creating a better user experience and a more seamless one so that we can give even better clinical guidance to our patients.
One of the things that I think make these two companies quite complementary is that Parsley is all about sort of not just treating symptoms, but the root cause of disease. And at Prenuvo, although we care what symptoms patients have, we give them a thorough, comprehensive imaging exam from head to ankles. And we look at the body as a system rather than a collection of parts. And I think that is a complementary approach to the way that we both look at medicine and the health of our patients.
A complementary partnership, and it sounds like your missions align. Anything more you can share about your individual missions and how you're coming together?
We sort of created Prenuvo really to right what we think is the biggest wrong in the healthcare system today, which is false negatives. People that go about their life, they might visit a doctor from time to time. They might think that they're healthy, but in fact, the tests that we're provided aren't very comprehensive, and there can be cancer or disease growing inside us, and we don't necessarily know anything about it. We also don't have a lot of feedback on how the way we're living our lives impact the underlying physiology of our bodies. And so Prenuvo really exists to look inside for many of our patients for the very first time and provide them with a really detailed and comprehensive evaluation of how their health is.
Comprehensively, how will this improve the patient experience?
You know, I think it is highly complementary because we also at Parsley have always been looking deeper. We practice something called functional medicine, which is the medicine of why. So we're looking at much more in-depth lab testing, looking at things like nutrients, toxins, hormones, heart health in a much more in-depth way. That's what people have always come to us with. And then more recently, there's other data sets like MRI that patients are coming to us with. And we are the providers that don't just give you data, we give you answers. And so we're there to help you interpret all of that and actually make use of it. And so as we were starting to see this happening and already doing this in our practice, we said, okay, how do we actually integrate the work that Prenuvo's doing into our workflow so that if you're a Parsley patient, you're working with us, we can order you the MRI, we can get those results back, and we can create a seamless data loop essentially so that patients can really feel that full care continuum. Right now, this whole ecosystem around longevity and health optimization and functional medicine even, right, can be really fragmented. And so bringing that together in one place, I think, gives patients a lot of reassurance. People are looking for those deeper answers. If they're coming to Prenuvo, if they're coming to Parsley, now we can do that together.
I want to hear how technology can play a proactive role in this collaboration.
It starts really with having a focus on serving the patient as the customer. I think too often in our healthcare system, it's maybe the insurance company that's the customer or the physician of the patient. It's not the patient themselves. And I think they're often sort of forgotten about and left to navigate in sort of a blind way their own care and care pathways. And so at Prenuvo, and I believe at Parsley, the goal really is for us to inform the patient, have them really understand what it is that is going on with their health and how they can advocate for better health outcomes for the individuals. And a lot of times that happens through technology. We at Prenuvo have an app where patients can actually look at all the images that we take. Typically in radiology, you might get an imaging exam and you have to go and figure out how you can get access to those images. They're not automatically provided. And then we provide patients with a very detailed review of every organ in the body and what we see and what we don't see. And if we see something, what should you do about it? And the goal really is to use this technology to democratize sort of information about a patient's health so that they can take control of it.
And Robin, to that end, what are the data insights and outcomes that you're hoping to take away from this partnership and collaboration?
For us, it's really about creating an even more supportive care experience. One of my patients, and I still see patients at Parsley, I'm also CEO, but one of my patients got a lung cancer diagnosis from a Prenuvo scan. And that was about a year ago. It was before our partnership. And it really inspired me because she proactively took it upon herself, get a Prenuvo scan. She ended up with a lung cancer diagnosis. And then I'm managing the patient and supporting her in what has been an incredible journey to treat the cancer. And by working together, we have been able to really shorten that cycle of, hey, I went and did this thing. I'm going to get it to you somehow and tell you about it. Now we can have access to that data, just like we always have at Parsley for our lab test data that we've done a lot of. We can similarly add in this data and make it something that we can help the patient manage right away. And I think that provides a lot of reassurance, but it also helps people shorten cycles between the point of getting information and the point of actually getting the treatment that they need.
And how these two pieces work together so beautifully is really what we do with imaging is we can see form. And then with a lot of the blood testing and biomarker testing, you can learn a lot about function. And the two of these together, it's not 1 + 1 = 2, it's really 1 + 1 = 10. In that, patients can understand what's going on with their bodies metabolically, and then also understand what impact is it having on organs and how our organs are aging.
I'd like to hear from both of you as to how you see this partnership really shaping the future of healthcare.
I think that we're moving into an era where this idea of proactive, personalized, precision care, these used to be buzzwords and people used to just talk about them as if they were a pipe dream from a really long time from now. And I think they're here. I think this is how we're able to practice medicine in 2025. And by bringing together these different types of data sets and services, I think we're creating an ecosystem that allows patients to truly own their health, right? We talk a lot about taking control of our health is what we all really want, but our healthcare system hasn't been set up to let us do that. In some ways, we're building together, I think, the new healthcare system that really allows people to take those steps.
Andrew, what would you say to that?
No, I think it's really well said. I think coming out of COVID in the last few years, people really started to take an interest in learning about their health. I think it was driven by people sort of losing a little bit of trust in the healthcare system during that period, I think unfairly in many ways, but also hearing about people that suffer from COVID that had these underlying comorbidities, and many of them didn't even know that they had them. And so people started to want to take initiative and look for answers themselves. And I think what we do at Prenuvo and Parsley really are, I think, the beginning of a huge wave in patient-directed proactive healthcare.
Well, it's wonderful to be joined by both of you here at the health event in Las Vegas. Robin Berzin, CEO of Parsley Health, and Andrew Lacy, founder and CEO of Prenuvo. Thanks again for your time.
Thank you.